Hello there, I'm Mabel Jung, and you're watching the World Healthcare Congress interview studio. I'm so pleased to welcome Dr. Joseph Kvedar to the chair. He is at Partners Healthcare in Boston. Dr. Kvedar, nice to see you.
You.
Well, first of all, since you are so involved with telemedicine, let's talk about smartphone and tablet technology. How really impactful is this technology in the care setting?
Well, the wonderful thing about mobile health and mobile technology is that it allows you to be in the moment with someone. You have this beautiful setup with a computer in your hand, always on the network. We can use it to collect information about you. We can use it to display information for you. We can use it to interact with you. But the key thing is it's in the moment when you need it.
Yes.
So it can be transformational. It
can
depends
be.
on how we, of course, set it up. But it has the capacity to be transformational, absolutely.
You've given a lot of talks also about engagement with patients. So does this technology distract both the physician and the patient when they're in the care setting?
So if it's a one-on-one with your doctor, let's say, or a nurse, then I would say the tablet doesn't have as much of a role there, because that's really special time that you should be spending with your provider. And a lot of the care alliance that you establish influences your outcome in that kind of a setting. It's really all those times when your healthcare provider is caring for you when you're not together, or when you're caring for yourself. The mobile technologies in both of those cases are really powerful.
Well, the data certainly is going to be a key as we move forward in reform, because the data is going to help make care more efficient. What do you think will also help get us to a more efficient, cost-effective care setting in the future?
The big thing we work on is tools that enable you as a patient to better care for yourself and feel better about it and feel cared for. So, of course, we can employ technology in a way that's very cold and sterile and non-friendly. We'll never do that. We're going to have all the appropriate ways of interacting with you, engaging with you as a patient, but we can do things like have you take care of your own blood pressure, have you take care of more care for your own diabetes, your cholesterol, all those things with proper training and proper guidance you can do for yourself. And like other industries where, for instance, you check yourself in at the airport or you draw money out of a teller machine, those are all more efficient because we've used technology to extend people. It's really not to replace, but to extend them.
What do you mean when you refer to the term sticky? In terms when you're talking about connected health or engagement with patients?
Well, what we find is that if I measure something about you, let's say your activity level or your blood pressure, some objective information about you, that in the beginning you'll engage with that alone and you'll learn about it, you'll get some insights, but very quickly it tends to fade into the background. And in the same way that certain designers have designed web applications or mobile apps to be sticky, that is, you keep coming back to that experience. We want to design your healthcare experience so that you keep coming back to check in on those objective data and improve your health. And that means changing the interface. That means things like adding games in or bringing in your social network or possibly some incentives, maybe a coaching voice. And it's different for everyone. But continually changing and engaging people around those data are what we find really move the needle on health outcomes.
We have had a lot of people sitting where you are from wellness companies and people who really specialize in creating a culture of wellness. Haven't heard so much about physicians talking about that. There seems to be a lot of other things they need to be worried about right now. But you do believe that creating that wellness in your everyday life is going to make a big difference for you and your care setting in the future.
Well, I'm really pleased to be both in a state that is pretty far ahead in terms of payment reform and in a healthcare organization, Partners Healthcare, that is quite on the leading edge of care management, population management, and we fundamentally believe that in a few years we will be in the wellness business. And so we're preparing for that. And the reason for that is that indeed, in order to really achieve this goal of population health, lowering the cost of care, we have to start catching things preemptively and proactively before you get sick. And that really means keeping you well.
What is your panel today that you'll be sitting on?
Well, it's a tough one, I think. It's called Healthcare, How Technology Can Transform Healthcare. And on the one hand, that's almost like a series of buzzwords, but when you really think about it, as we've been talking about, the danger is that if you don't use healthcare well, it gets in the way. If you don't use technology well, it gets in the way. If you use it really well, people don't even know it's there.
Right.
And so that's what we'll talk about. We have really good speakers, and we're going to talk about how you can appropriately employ these tools to improve individual and population health, but not make people feel like they're being cared for by technology.
Do you think that at some point physicians may have a different role to play if we start making it very normal for people to get care through e-health, telemedicine, and the physician is sitting back in his office and not even really having that physical interaction with the patient? Will the role of the physician change in the future, and is that something that's inevitable?
My answer might surprise you. I don't think the role is going to change a great deal, because our role actually is to be your health advocate, be your coach, help you get better. And what we've learned at our center over the years is that paradoxically, when you include a technology such as home monitoring or a video visit, if you set it up right, people feel more cared for and they feel more connected with their doctor, not less. And it's really about using the face-to-face time to be the maximal possible value that you can get out of it, and then extending that person to a variety of other channels so that you feel cared for all the time, not just when you're in the doctor's office.
Dr. Kvedar, thank you so much for
Great
your
to
time
talk
today.
to you today. All right.
Great to talk with you. And I'm Mabel Jong. Thanks for tuning in.